Close to 11% of US residents are diabetic. That's about 35 million people. Yes, today we're going to talk about diabetes and in prevention, better than cure, in the series Aware and Care. To give more information about how to prevent this disease, we have to welcome Dr. Ambika Nair. Namaskaram, Doctor, the co-founder and chief consultant of Santhigram Group of Companies. They have offices here in the tri-state and across the globe. Online consultation also available. How are you, Dr. Nair?
Namaskaram, how are you?
I'm doing very good, Dr. Nair. 11% of the population is diabetic or almost leading towards that. That's a huge number if you're talking only about the US. As a program reaches to varied groups of people across the globe, today let's understand a little bit about what's diabetes. And after that, we will go towards prevention because prevention is always better than cure.
Actually, diabetes is not a disease.
Mm-hmm.
People will, it is a disorder.
Okay.
Yeah. But nowadays, it is the burning problem, all over the world, not only in America. People are eagerly waiting for a quick and permanent cure. They want just one pill and they want to be better,
True.
So as when you look at the pathology, it takes like a long route for manifestations, finding an instant remedy or anything like that. It's very difficult. But we have to see, that it is always involvement of the body and the mind. So it will be very essential to understand, see also what the people eat, how their food habits, and, whether they have any stress, because the body and mind is involved over here. Okay, so we have to find out everything, not just like that.
Okay.
Fear of the disease also dangerous actually, because there is, no need of getting, but how to come out from the disease. That is more important actually.
That's true. So, friends, we have done lots of series here on Aware and Care. There have also been episodes where we've spoken about how to take care of diabetes. But as we mentioned, it is prevention better than cure. We have started the series to introduce you to early detection or to see methods to avoid it. Dr. Nair, the one thing that people are very happy about when they go for a blood test is when they hear that they are borderline, because borderline is still a hope that they can curb this problem before it explodes more into it. So what is this A1C that people get so excited about and say, you know what, I'm still borderline, I can do whatever I want?
No, like type 2 diabetes, when the A1C goes, because the, complications will be more if the A1C goes, because involvement of the heart, everything will be kidney, everything can be there. So, if all the system will be getting affected. So that's why, like a pre-diabetic, because diabetic will not come in one day, except when you have very bad infections or you're forced to take some other medications like heavy steroids or anything like that, or some injury or anything, to the pancreas or something. Otherwise, it will not come just like that. It always gives time. Nature always gives us time to understand you are going to be diabetic. So if we take care, if we understand our body and if we take care, definitely you can reverse diabetes.
That's a very beautiful statement that you mentioned, that nature gives us time to correct ourselves and take the right remedies at the right time. Dr. Nair, is it a lifestyle disease or is it genetic? Because there's too much of confusion.
It is a lifestyle plus genetic also. Sometimes, hereditary, we get a lot of clientele like that. They will tell, oh, no, my parents are. Actually, it's not a must that you should get it. If you really take care of from the beginning, when you're like 30, like even 28, excess of eating all sugar, watching your diet a little bit and doing little exercise, it makes a lot of sense.
Okay. So, but when we speak about lifestyle versus genetic, is there a specific body type people who have to be more careful or they are more prone towards it?
All the three doshas will be, involved in this, because kapha. Kapha means earth and water. See, if you are sedentary, if you don't feel hungry, also excessive eating, that is because, you are little voracious in eating around because of your mental stress. Sometimes you don't feel like doing, you feel very happy to be on the bed or working, especially in, like people sitting in front of the computer, they don't feel like getting up because they enjoy that actually. So this all involves a lot, because see, that has become a habit for them. They don't want to break it. So these are kapha people, and pitta is also involved, even your digestion is on the poor side. You can see when you go for the blood work, and you can see, LDL is on the lower side, your triglyceride will be on the higher side. So involvement of the, all the three doshas, sleep is not there, You did not even sleep for like a 3-4 days. So the stress level. So these are the contributing factors. And we should be able to diagnose ourselves, that is an awareness that your body is having some changes, what you're observing. Like sign and symptoms, like a little bit of excessive thirst. You're going for like a polyuria, like a continuously, like a passing urine. Some days you lose weight, there is no appetite. Then, sleep problems will be there, numbness, mouth dryness, skin dryness, little things, hair fall. Sometimes you can see, like a hair will be very brittle also. Hair growth, because it all depends upon the ages also. You understand?
Okay. Sure. Yeah. So when you talk about ages, of course, we'll get to that. But friends, there's a couple of things that we have to still note again, that all the remedies and solutions that are given here on Aware and Care, also in the segment, prevention is better than cure. Please remember to consult a doctor, because there are a lot of remedies which may not be particularly suiting you because of your food allergies or other underlying factors. Dr. Nair, you just mentioned about age. Of course, we want to throw this out there that today more and more younger generation is also getting diabetic. And the very interesting aspect that you mentioned is, let's not call it a disease, it's a disorder. And people tend to get very stressed out the moment they come to know that they are diabetic. Now, let's talk about the best part about this program, how to prevent diabetes.
First of all, like unwholesome diet. Like we don't eat the proper way of eating. Like any junk food or anything like that, they will be eating like that. Okay, so that is not at all, like even our grains has to be old grains only we should eat.
Okay.
And like I'll tell what all they should eat first. Okay. Our Asian, vegetables are very good. First of all, Karela. Okay, that is very good. Even drumstick is very good. All drumstick leaves are good.
Okay.
So green gram is good.
Doctor, before you list out the foods that can be eaten to help or prevent or keep this in that, how important it is to start this early? Because sometimes I don't like drumsticks or I don't like moringa leaves. What happens? How does a family introduce all this into their eating habits?
So it all depends upon the mother.
Okay. And the father.
Yeah. Okay. Whoever is in the kitchen, you understand? No?
Yes.
Making the wholesome food, like so that the children will get a taste. Little when you introduce, then like so since like in South India and all, we are used with all those things. So when you come to North India, it's a little bit difficult. But now everywhere awareness is there.
Yes, and the products are available also.
Everywhere it is available, And like our snake god is there, bitter god, all the gods, like even garlic. There are so many, like a wholesome, like old wheat, old rice. But rice, like in these cases, if it is not old, we don't use it. Actually, we won't tell them also to use it actually.
Okay.
Yeah.
So Dr. Nair, because there is this misconception about today's generation that they say rice is very bad. Your body needs constant exercise along with to digest it and do it, because today with so many gadgets and easy access.
Then, like a green gram is there. So many lentils are there. Green gram, horse gram, vegetables which are bitter in taste. Because when we say that only, they will get mad at us. But still it is good, So, like even flesh of animals, but it should not be like staying in the marshy areas. This is all very good actually. We have to be very choosy whenever we buy things actually.
Okay.
Now, leafy vegetables, but whatever you buy and eat, it should digest actually.
Dr. Nair,
no constipation. Yeah.
So when you're mentioning all these foods, I'm still curious to understand. There are so many health conditions out there where diet plays a very important role. But when it comes to diabetes, why is there so much of emphasis on their diet? Of course, for a healthy body, a good diet is a must. But the moment somebody says diabetic, people have this question, oh my God, what do you want to eat? Or what can you not eat? Why is there so much of correlation in that?
Because we should always say sorry. When they are forced us to eat, we should watch we are eating, because that is that awareness about the body should be more important in our life actually. See, like the sweets, you cannot eat sweets. That should be even jaggery. Lot of like people who eat a lot of yogurt, too much yogurt. everything minimum it will work in the body.
Okay.
Okay, yogurt products, even like milk products, too many, it will not work. Too much. Anything, excess never will work.
Okay.
Yeah, and too much of ghee, like deep fried food, sour beverages, even drinking habits. This is all we tell them not to drink. They will get they will look like this, So much of carbohydrates rich food should be avoided. In new grain should be avoided. Day sleep so that they don't put on weight. So many, all these things, we have to take care of that actually.
Okay, you mentioned about some vegetables here. You also mentioned about a couple of grains, and let's understand a little more about carbohydrates. You just mentioned rice. Can we continue a little? What about chapatis and wheat and maida?
No, chapatis, but it should be from that old wheat, like it's not like it's stored for a long time, not the new grains. That should not be, like even kapha will tell that. Kapha is actually, see, what we overeat actually. This is overeating. If we eat minimum, nothing will happen. So but overeating, which will not even digest and assimilate.
Okay.
That really creates all these issues.
Okay.
And you should watch whether you have a constipation or not. If constipation, if your bowel movement is good, everything will be fine. So your acne in the stomach, the acne has to be better. No bloated abdomen. That's why watching the body a little bit. Sour food, like so much of ghee, sugarcane juice. Yes, they will think that this all will work, Sitting in one place for a long time, no, always sedentary work, no movement at all. They don't go out. Exercise is more important in this actually. Getting up early morning. You should have a dinacharya. A
routine. Absolute regimen and a routine. Now, tonight you're talking about the foods. Now, when we say lifestyle involves foods, we can't have sedentary lifestyles. What is it that should motivate a person to go forward? Of course, health first. So in your perspective, from a doctor's perspective, what is your final word to people to prevent diabetes? You have suggested most of the things, but yet there is always that one final mantra that you give and you say, you know what, this is it.
No, that we can do it. Actually, there is no problem, Only problem, like, especially when we go to the party and all,
Yes.
That's what I told you, try to learn how to say sorry. That is more important, actually. We don't say sorry.
You don't say sorry, especially to food. Friends, that is the Maha Mantra today when you're thinking about, how to prevent diabetes. As I just mentioned, 11% of US population is today diagnosed with diabetes, and it is a disorder. It is a condition that can be taken care of which we have covered some episodes. Today's episode, we're talking about how to prevent it. Yet again, the Maha Mantra here from Dr. Nair and all the doctors across the globe is basically to have your food and your regimen and your routine right. Apart from the little bit of exercise, and like Dr. Nair just mentioned, reduce your stress. And how to reduce stress?
If you find, like so much of fatigue is there, you cannot concentrate, you crave for sweets, all these things are, like it comes in the body when you have diabetes. Like excessive taste, like so much of fatigue, irritating, mentally they get irritated, want to lie down every time. So these all, when you experience, and the numbness, tingling in the body, like a pricking. Okay. So all these things, that you should always note it down and try to see a doctor at that time. That is more important. So especially in Ayurveda and all, it can be reversible and it's not a big issue.
Okay. Dr. Nair, there was a question from our viewer talking about this particular topic, asking if castor oil or oil pulling will help to prevent diabetes.
Castor oil is very good, like a daily routine. You can take like a 1 teaspoon at bedtime. Oil pulling, it will always enhance, like it will help you to prevent all the oral conditions, that is, see, like in diabetic also, we see the symptoms are like too many, like a soreness, like, like tongue will be very important. You don't get a taste and all those things, that oil pulling will help a lot. But you have to have a guidance from a good doctor so that they will always help you to not only to prevent, to bail out from the disease.
Absolutely. Thank you. So that was a beautiful message. And today we spoke about how to prevent diabetes. Many of you watching this would say that, hey, you know what? I know everything that Dr. Nair has said. So what is the point now? Well, you have to start implementing what you've heard and what you know to prevent any health conditions, impending health conditions, genetic or as well as lifestyle. Thank you, Dr. Nair, for today's episode. I look forward to many more episodes like this, which has become very popular with our viewers, and they're thanking you and the team of Santhigram. Thank you.
Thank you so much.